Ultrasound is a powerful non-invasive medical imaging technique that allows clinicians to visualize internal structures and organs to monitor health or diagnose disease. Doppler ultrasound is a specialized ultrasound technique used to measure the speed and direction of blood flow in various parts of the body, such as the heart, brain, or extremities. It can be used to detect arterial narrowing or blockages that could increase the risk of stroke. However, traditional Doppler ultrasound probes are rigid, handheld devices that are designed for intermittent rather than continuous use, so that at best, patients at risk for developing stroke or other diseases are checked just once or twice a day. To address these limitations, several research groups have previously developed wearable ultrasound patches that conform to the skin, enabling continuous imaging of blood flow without the need for manual operation. Hands-free continuous ultrasound imaging could transform healthcare by allowing clinicians to monitor transient hemodynamic changes in real time, giving us a better understanding of disease progression and risks. Most of the wearable ultrasound devices developed thus far have been stretchable, resulting in improved wearability compared to traditional rigid probes. However, they have limitations such as a lack of an acoustic matching layer between the piezoelectric element and the skin. An acoustic matching layer is used in traditional ultrasound probes and is carefully designed to have an acoustic impedance that is intermediate between that of the piezoelectric element and the tissue being imaged, maximizing transmission of ultrasound waves into the body. However, existing matching layers are typically composed of rigid particles embedded in epoxy resins, which do not have the stretchability necessary for conforming to the skin and thus cannot be readily used in wearable ultrasound devices.
To address this limitation, we have created a wearable ultrasound patch with a soft and stretchable, mechanically compatible matching layer. The ultrasound patch consists of 2D and 3D elements that are assembled into a multi-layered device. Flexible electrodes were created using laser patterning, consisting of a common ground electrode on the bottom and individual electrodes on the top, allowing the transducers to be independently addressable. The piezoelectric transducers were then sandwiched between the electrodes and connected using a silver epoxy. The entire device was then backfilled with a soft silicone elastomer.
To determine the optimal layout of the transducer array for the wearable ultrasound patch, the Doppler signal for the middle cerebral artery, or MCA, was recorded at the temple location from multiple test scans using a handheld ultrasound device. Based on the best signal locations observed in the scans, the elements of the array were arranged within a bounding box to maximize signal quality. By using a transducer array, the wearable ultrasound patch will be able to accurately locate the MCA through beamforming without requiring manual repositioning.
Most stretchable materials, such as silicone or polyurethane-based elastomers, have relatively low acoustic impedance values that are similar to human tissue. The acoustic impedance of these soft materials can be increased by adding rigid fillers. However, this results in mechanically stiff materials that cannot support stretchable functionality. Alternatively, by incorporating liquid metal microdroplets into a soft and elastically deformable silicone elastomer, we were able to achieve an increase in the acoustic impedance of the elastomer without altering the stiffness or strain limit. Here you can see that as the loading of liquid metal in the elastomer is increased up to 50% by volume, the density of the composite increases linearly, and the speed of sound through the material decreases. The decrease in the speed of sound is expected and can be predicted by the Woods model as indicated by the dashed line. The acoustic impedance is the product of the material density and the speed of sound through the material, which is shown to increase with liquid metal loading. The optimal acoustic impedance is shown by the red dashed line, and the shaded region denotes acoustic impedance values which transmitted intensity is greater than 90% of the possible transmitted intensity.
This initial study illustrates that the liquid metal composite offers an alternative to traditional ultrasound matching layers that is mechanically compatible with the human body and existing wearable ultrasound patches by providing a unique combination of high strain limit, low elastic modulus, and tunable acoustic impedance. We are currently evaluating the matching layer on a Phantom to evaluate improved imaging performance of the device. After an initial evaluation, we aim to complete a small usability study to demonstrate the ease of use.